Good morning, ma'am.
Morning, ma'am.
Evening, ma'am.
Okay, how are you all today? All good, ma'am. You? I'm also good, thank you. So, did you go through previous lectures, your notes and others regarding antifungal drug?
Yes, ma'am.
Okay. So, any confusions? Anything you want to again discuss? I can see 68 participants, including host and myself. So, just want to discuss. Want to know what is that, the problem and anything. Okay, so take it in a very simple way. Don't study in complicated manner at the beginning. Okay, once you get the concept, and then you can go in another layer of depth. So the way of studying is like that. I guess there should not be any confusions actually. I have tried to simplify that. So with its reference, you can go ahead. But still, if you have any confusions, any questions, you can discuss. Have you been taught about fungal cell in microbiology?
Yes, ma'am.
So you know the fungal cell structure and others, right? Hey, fungal cell wall, cell membrane को कुरा थाहा छैन हैन धेरैलाई?
हामीले क्लासिफिकेसन चाहिँ पढाएको छौँ, सेल स्ट्रक्चर चाहिँ ब्याक्टेरियाको मात्रै पढाएको छौँ, फंगसको चाहिँ पढाएको छैन।
फंगसको चाहिँ पढेको छैन। अनि मैले जति पनि पढायो त्यसको लागि बुझ्ने मटेरियल ठिक छ कि छैन त? त्यो कन्सेप्ट लिन सकिन्छ कि छैन मैले भनेकोबाट?
छ म्याम, हजुरले त्यो कम्पोजिसन भन्नुभएको थियो अनि सो इट वाज इजी।
सो माइक्रोबायोलोजीमा डिटेलमा हुन्छ हैन, हामीले सबै कभर गर्न सक्दैन। सो वाट एभर वी रिक्वायर वी आर मुभिङ अन टु द्याट। सो आजको लेक्चरमा पनि हामी बाँकी पढ्दैछौँ। सो वी स्टप हियर इन एन्टिमेटाबोलाइट, राइट? Antimetabolite flu cytosine start गर्दैछौँ. So we have seen that where is its target site. So definitely it is going to act in the nucleus, in the DNA. So त्यहाँ पनि मैले एकदम छोटो रूपमा भन्छु. The steps are, there are many steps in the synthesis of DNA. Okay, you need not have to worry at the moment. So which step is inhibited or which is stimulated or where does it act? We are just going to look at that. यसलाई अलिकति सिम्पल बनाएर लान्छौँ. So the names may sound a bit complicated, but it may not be to you as well. You need not have to worry. I will tell you what to write, okay? If it is very difficult for some of you. Anyway, try to see the things, whatever in this slide. I will be providing that and in books also. So whatever steps we require, we are just moving on to them. Similarly, for azoles also, we will be studying this morning. There also, we will be studying in the similar manner. Okay, so all these steps we won't be covering, like synthesis of ergosterol and others we need to know. But whatever we require, only those things we'll be studying, like I have shown in my first lecture or previous lecture of antifungal drug, the target. So only those things we are going to cover here. Okay, so flu cytosine case is a little bit different as it acts in the DNA. Not acts in the DNA, it acts in the nucleus and in its DNA synthesis. So in the similar way, in simple way, we are going to study. And that should be more than enough to you. Okay, I can see 77 now. Shall we start then? Start गरौँ. कसैलाई के confusion छ अहिलेसम्म है? So know the basic structure of fungus. Okay, that is my suggestion. किनभने मलाई I was after that whether you will be knowing fungal cell or not. But anyway, I have tried to explain whatever I need to give you the concept of antifungal drug. So that should be more than enough for all of you, okay, at this level. So do not worry. There are a lot more things you will be again studying in microbiology. So we will just stick on to whatever is here according to the Cat Jung's cartoon. Okay, and those things again in flowchart form I have tried to incorporate. So it's like that. So I'm going to start now. I can see a few more participants. So let me stop the video. Okay, I will be providing slide once I finish this lecture. So I will be moving ahead and we'll talk about practical bit in next class or if time permits today. Okay, let me start then. So today we are continuing with our another antifungal drug, flucytosine. Its name is actually 5-flucytosine. Okay, you can just remember flucytosine. So anyway, in abbreviation, in standard abbreviations in the standard books, you will be seeing F5FC. Okay, you need not have to be confused regarding that. So please remember 5FC is flucytosine. It is 5-flucytosine. So what is it? It is a synthetic fluorinated pyrimidine. Okay, and it is a fungistatic drug. It has no intrinsic antifungal activity as such. So why are we using? What's the purpose? So actually, it means flucytosine on its own or itself, it is not active as antifungal drug. It has to get converted into some other metabolite, some other active component, then only that will show fungistatic property. So that is the thing which is written here. It has no intrinsic antifungal activity as such. As such, यसको antifungal activity छैन. यो कुनैमा convert हुन्छ जुन अहिले हामी हेर्दैछौँ र त्यसपछि मात्र certain ठाउँमा act गरेपछि यसको action हुन्छ fungus growth मा inhibition गराउनको लागि. So let's take the same reference which we have taken for amphotericin B. This is fungal cell membrane. Everybody knows about it. Okay. And here the light yellow kind of, or I don't know what color is coming in your screen. They are ergostrip. Okay. We have to just remember those things. And here I have added some another like transporter kind of thing. So just wanted to show how it gets transported first. So flucytosine 5FC, when we administer it, it enters the fungal cell. Okay, it gets access into the fungal cell, inside the fungal cell, with the help of cytosine permease via this transporter. Okay, so cytosine permease helps the entry of 5-flucytosine inside the cytoplasm of the fungal cell. As itself, we know it has no intrinsic fungistatic property, so we expect its conversion to something else, that is 5-fluorouracil. You might have heard about it. No. You will be studying this in hematopoietic plaque again, in anti-cancer plaque. So 5-fluorouracil is formed from 5-flucytosine with the help of enzyme cytosine deaminase. Okay, there is deamination of 5-flucytosine to 5-fluorouracil. So this is the drug, or this is the metabolite. We can't say drug here. This is the active metabolite of flucytosine, which actually possesses fungistatic property. So let's see how. Okay, it gets then converted into another metabolite, 5-fluorodeoxyuridine monophosphate. If you can't remember the name, forget about it. But you have to remember 5-fluorouracil. But if you can, you need to. है आत्तेर केही आएन भने के गर्ने फेरि पछि भनिदिन्छु सुरुमै भन्दा झन् कन्फ्युज होला 5-fluorodeoxyuridine monophosphate is formed, and that has inhibitory effect on the thymidylate synthase enzyme. So what is role of thymidylate synthase? It has very important role in conversion of one particular component to another essential component, which is the component of fungal DNA. यसले के गर्दो रहेछ भने एउटा component fungal nucleus भित्र भएको deoxyuridine monophosphate लाई thymidine monophosphate मा कन्भर्ट गर्दो रहेछ. कुनै कुनै बुकमा यसलाई thymidylate अथवा thymidylate acid भन्ने पनि लेखेको छ. It's same, don't get confused. Okay, so this is major component or very essential component of the fungal DNA, or this is required the DNA synthesis of fungus. So के हुन्छ त भन्दाखेरि can you please mute mic कसैको background noise आइरहेको छ. Okay, so when you give 5-flucytosine or just flucytosine, it gets into the fungal cell by with the help of enzyme cytosine permease, and it gets converted into 5-fluorouracil. So 5-fluorouracil undergoes other pathway which which inhibits the enzyme thymidylate synthase. Okay, and thymidylate synthase is very important enzyme in the synthesis, which helps in the synthesis of thymidine monophosphate or thymidylate or thymidylic acid, which we need to know is that which is very important component of DNA, which is very essential for the synthesis of fungal DNA. You can write down like that. So what will happen once this thymidylate synthase is inhibited? Thymidine monophosphate will fail to be synthesized, will fail to occur, and it inhibits DNA synthesis of fungus. So if DNA synthesis is inhibited, fungal reproduction will be ceased. Okay, there will be inhibition of the fungal reproduction, their growth will be ceased. So that's how it possesses fungistatic property. Actually, different steps are. If possible, I think most of you can do it. But what is the essential thing or mandatory thing you should not miss, or if it comes in exam, practical exams and others, I don't think it is there in drug profile. Anyway, what you need to know, what you should not forget is that eucorin. है बिर्सनै नहुने चाहिँ 5-flucytosine को as it is कुनै पनि fungistatic property छैन, it has to get converted into 5-fluorouracil, and that happens inside the fungal cell. Okay, in the cytoplasm that happens. So first it has to get access into the cell, entry हुनु पर्यो, केले help गर्यो, cytosine permease, अनि cytosine deaminase you have to remember. Okay, this will help in conversion of flucytosine to 5-fluorouracil. Okay, and this has antimetabolite property. That means it inhibits. Okay, sorry. 5-fluorouracil will inhibit, will undergo other pathway, which cause undergo other pathway किन भनेको भन्दा यो सम्झेन भने है, or if possible you can write this down. 5-fluorodeoxyuridine monophosphate, which inhibits conversion of which inhibits synthesis of or something like that, formation of thymidine monophosphate. कसरी? Because it inhibits thymidylate synthase enzyme. Okay, thymidylate synthase enzyme is very essential in the formation of thymidine monophosphate or thymidylate or thymidic acid, thymidylic acid. And we have to remember this is very important component of fungal DNA. So if this is not formed, if this is not formed, if this is not formed, then fungal DNA synthesis is inhibited. So fungal reproduction okay, यहाँबाट सुरु गरौँ थियौं के भन्ने. So it is narrow spectrum drug. It is mainly active against these fungus. Okay, and it, you पनि केही सुनेको थिएन, कसैले पनि सुनेन अघि?
No, ma'am.
Okay, so resistance has almost developed for most of the antimicrobial drug, हैन, हामीलाई थाहा छ त्यो. So we want to see what are the potential mechanism behind that. So regarding flucytosine's resistance towards fungi, against fungi, there can be decreased uptake. Okay, loss of permease activity. If there is loss of cytosine permease activity, then the uptake will fail to occur and it cannot enter inside the cell. So that can lead to resistance. And next is, even if it enters inside the cell, sometimes few of the fungus, they might lose the their property of cytosine deaminase. So there won't be deamination of 5-flucytosine and no conversion into fluorouracil, 5-fluorouracil. So these two might be the reason behind the resistance developed against flucytosine. So what are the therapeutic uses? Okay, as monotherapy, its use is limited. Like as single agent, it is not used. However, it has been used or added with other drugs. Right? As an additive or adjunct, this flucytosine is used in few conditions like candidiasis, cryptococcosis. Okay, in aspergillosis, more or less, it is sometimes used, but that is not so common. So in these two cases, particularly candidiasis and cryptococcosis, in combination with amphotericin B or fluconazole, it is used. Fluconazole you haven't studied, so I was nearly there. It is in azole group of the drug, so we are going to study that later. Okay, so it is flucytosine is used with them. Adverse effects. There is dose-dependent bone marrow depression. Okay, so if we use higher dose or for prolonged period, there can be bone marrow depression. It is mainly because of antimetabolite effect of flucytosine. And I told you, like 5-fluorouracil will be taught in anti-cancer drug. We will know later. So this is one of the major adverse effect of flucytosine. And another is GI disturbances. अहिलेसम्म GI disturbance सबैमा लेखे पनि ठिकै हुन्छ. So azoles is another group of drug. Okay, we finish antimetabolites. So flucytosine is drug which targets the fungal DNA. Okay, किन भन्दाखेरि यसले fungal DNA मा हुने एउटा एकदम essential component लाई form हुन नदिँदो रहेछ. So various steps we have seen, we have discussed. Have a look. Next is azoles, imidazoles and triazoles. So they are chemical structures. And it's my imidazole ring to triazoles. We are going to study that now. They are also synthetic fungistatic agents. Fungicidal and fungistatic agents. So, and they are broad spectrum drugs. Broad spectrum in the sense, apart from fungus, various fungi, they also act on parasite leishmania and in bacteria, these bacteria. Okay, so azoles are broad spectrum antifungal drug which have action on bacteria, parasites, and fungi is definitely there. Okay, again taking the same reference of cell membrane, here I am showing the two steps here. So I have more or less highlighted the synthesis of ergosterol. By now you can make a guess, maybe azoles have something to do with ergosterol. Ergosterol यहाँसम्म हामीले अघि देखेको थियौं. So now onwards I will be showing few more steps later as well when we reach that particular drug, when we touch that drug. So for azoles, we just need this step. So ergosterol, which is very important component, which is found abundantly in the fungal cell membrane, is synthesized from lanosterol with the help of lanosterol 14-alpha demethylase. Okay? So when you give azoles inhibit this enzyme lanosterol 14-alpha demethylase. So what will happen? Definitely ergosterol will decrease. More further synthesis of ergosterol will stop. So there is lacking of ergosterol, if there is not optimal level of ergosterol here in the fungal cell membrane, what will happen? The membrane structure might get disrupted. Okay, we call that fluidity of the membrane. The fluidity of the membrane will not be maintained and the function of the cell membrane will not be maintained and fungal cell death occurs and the growth will stop. So because as there is less ergosterol, which was supposed to be plenty here in the cell membrane to maintain the membrane structure and function, there is less now. In presence of azoles, so there will be disruption of the membrane structure. The membrane fluidity will not be maintained and so do its function and the fungal replication will cease. Okay, this will inhibit fungal cell growth or fungal replication will stop. So keeping it very simple, azoles inhibit the synthesis of ergosterol. How? By inhibiting enzyme lanosterol 14-alpha demethylase. So lanosterol won't be converted to ergosterol. Ergosterol come hune bittike weak huncha cell membrane. Okay, so let me show you one of the microscopic picture of Candida albicans. Candida albicans in presence of azoles. Okay, so here this picture is, this slide is showing the structures of Candida albicans. Their membrane, you can see they are reproducing as well. Okay, we also must have seen in our vicinity fungal growth hunda mold cell ma herda pani कस्तो राम्रो फर्मड भयो भने उनीहरू हेल्दी भनेर थाहा हुन्छ हैन कुनै कुनै डिस्ट्रोय भयो भने हेल्दी हुँदैन त्यस्तै हो सो दिस इज क्यान्डिडा अल्बिकेन्स हैन उनीहरूको ग्रोथ हुन लागेको भयो एन्ड मेम्ब्रेन इज सो स्मुथ यु क्यान सी दे लुक सो हेल्दी बिफोर एक्सपोजर नाउ आफ्टर एक्सपोजर टु द एजल्स यु क्यान सी दे आर रिङ्कल्ड हैन त्यहाँनिर सङ्कन भएको देखेको छ हैन सबै नभए पनि कतिपय भएको देखेको छ र नम्बरलेस देखेको छ that means the membrane fluidity is lost as there is lack of ergostrol as lanostrol is not converted to ergostrol okay in presence of azole so they will definitely will die so further reproduction won't occur and whatever healthy so their growth will be ceased here. Okay, so this is mechanism of action. This is the microscopic slides of the Candida albicans. Their growth ma kasto effect bhayeko cha kasto dekhincha dekhako so that you can visualize. Okay, clotrimazole. यहाँ पनि मैले के भनिसकेको थिएँ सुनिरहेछ?
Yes, ma'am.
Ma'am. So clotrimazole is a prototype drug. Here I have said lots of things before. So what I said here is that similar to this drug, similar sound गर्ने, similar to this drug हैन कि similar नभनौँ तर मिस्टेक हुँदा हतार हुँदा सिमिलर हुने र मेडिकेसन एररको रिपोर्टमा एभिडेन्समा एकदम फ्रिक्वेन्टली इन्काउन्टर भएको मेडिकेसन एरर अर प्रेस्क्रिप्सन एरर भएको इन बिट्विन क्लोट्रिमाजोल एन्ड क्वाट्रिमोक्साजोल Okay, very frequently this mistake has occurred while prescribing Walmart. Quatrimoxazole, that was sulfamethoxazole plus trimethoprim हामीले पढिसक्यौं combination, but this is clotrimazole. So use any technique to separate them, to memorize, not to mix up them while even if you are in hurry or even if you have anxiety. है यो धेरै frequently हामीले पनि पेपरमा पाएको mistake. The clinical practice ma pani paeko mistake spelling ma अथवा handwriting problem. Okay, so it is clotrimazole, which is azole antifungal drug, prototype azole, and that was quatrimoxazole. Okay, that didn't have L in after C. L bug was in fungus, antifungal. So this is prototype drug. Okay, know them. It is only used topically in the form of various doses form like pessaries, lotion, powder, cream. यो धेरैले युज पनि गरेको हुनुपर्छ देखेको पनि हुनुपर्छ हामीलाई कुनै फंगल इन्फेक्सन भयो भने पसलमा गएर किनेर लाइराखेको हुन्छ थेराप्युटिक युजेस एथलेट्स फुड सो यु नो एथलेट्स फुड हैन हामीले धेरै बेर सक्सहरु लाउँदा स्पेशली जो धेरै स्वेटिङ गर्ने अथवा खुट्टा भिजेको छ दिनभरि जुत्ता लगाउने मोजा लाउनेहरुलाई भइराखेको हुन्छ हैन सो एथलेटहरुलाई हुने भएर एथलेट्स फुड पनि फंगल इन्फेक्सन automycosis and also in other oral, cutaneous, vaginal candidiasis and even in vaginitis, clotrimazole is effective. Adverse effects. Local irritation, as it is applied locally, there can be local irritation to few of the sensitive people and normally what we tend to generalize is that if this clotrimazole, very common and popular drug, is useful in these cases, we blindly think that this might be useful in the fungal infection in scalp and in nails. Okay, that is caused by tinea capititis and tinea unguium, but that is false. In less effective ones. So it is less effective against tinea capititis, scalp. It is not adverse effect. Add gareko matra. Scalp and tinea unguium nail. Nail र scalp मा त्यति effective नहुँदो रहेछ clotrimazole, though it is very very commonly used and popular drug. Remember that. There are others for that. So next is iconazole and miconazole. Iconazole. It is similar to clotrimazole and its therapeutic uses are dermatophytosis, automycosis and in oral thrush. Vaginitis. In vaginitis, maybe we prefer clotrimazole. It is inferior to clotrimazole. Miconazole, therapeutic uses in tinea, pityriasis, versicolor, automycosis, cutaneous and vulvovaginal candidiasis, onychomycosis. Miconazole is used. Next is ketoconazole. This one also you might have heard about it. है कुनै एन्टिफंगल ड्रग ड्यान्ड्रफहरु हुँदा डर्मेटोलोजिस्टले प्रिस्क्राइब गर्ने स्याम्पूमा ketoconazole हुन्छ in most of the samples. It is first orally effective broad spectrum antifungal drug. Orally दिने azole broad spectrum. Oral absorption is high in acidic pH. Often to enhance its oral absorption, often it is given with cola or fruit juice. किनभने उनीहरूले pH कम गर्न acidic pH हुन्छ they have. So for enhancing its oral absorption, you can sometimes give it along with cola or fruit juice. It has very high protein binding. More than 99% drugs are protein-bound drug. So we expect many drug interactions. Therapeutic uses. Dermatophytosis, in seborrhea of scalp and dandruff. I told you before. Miserol भन्ने shampoo हुन्थ्यो हामी सानोमै आएको थियो त्यो चाहिँ. So you might have seen some of the people, they suffer from lots of scaling in scalp, हैन dandruff जस्तो flakesहरु नि बाहिर आएको हुन्छ त्यो. So they definitely need the treatment, and that is fungal infection, है hygiene maintain नभएर, and there are many more reasons. So in seborrhea of scalp and in dandruff, ketoconazole is used. Remember, this is peculiar with it, don't forget it. And in monilial vaginitis, systemic mycosis, it is useful. And also in dermal leishmaniasis and Kala-Azar, occasionally ketoconazole is used. Adverse effects. I have made it bold. Nausea, vomiting, very common one. Similarly, others, loss of appetite, headache, paresthesia, rashes, hair loss, gynecomastia, oligozoospermia, decreased libido, menstrual irregularities are found, hepatotoxicity, increase in transaminase, liver enzyme, transaminase enzyme increase भएको देखेको छ, which can lead to hepatitis. So this is ruled out before you give the systemic treatment with ketoconazole or long-term treatment with ketoconazole. So coming to contraindication, pregnant and lactating mother. Okay, so यसको ketoconazole को adverse effect भन्नुपर्दा, this is common, that's fine. Please remember this, है gynecomastia, oligozoospermia, decreased libido, menstrual irregularities. This is also very clinically important and common with ketoconazole. Okay, because ketoconazole also inhibits the synthesis of steroids, sex hormones in male and female. So that can lead to this kind of problem. So contraindicated in pregnancy and in lactating mother. So what are drug interactions? I told you we expect a few more drug interactions here. So rifampin, phenobarbital, carbamazepine, and phenytoin decrease ketoconazole level. They decrease the plasma concentration of ketoconazole. Kinada, they are liver enzyme inducer. Sulfonylureas, यिनीहरूले यसको metabolism induce गर्दिने. Sulfonylureas, diazepam, nifedipine, indinavir, there are many more. मैले several names राखेको, you can pick any of them, whichever you know. So ketoconazole increase their plasma level because ketoconazole is highly protein-bound drug, and so do they. They are also protein-bound drug. So when you give another protein-bound drug with protein-bound drug, the chance is that they can compete for same binding site. So that will be happening in between these drugs. Okay. So if the sulfonylurea is given along with ketoconazole, this is anti-diabetic drug. For example, if it is given with ketoconazole, then maybe ketoconazole will be displaced from its binding site and its level will increase. Okay. So its affinity will be higher than ketoconazole. So some kind of reaction takes place, interaction. So warfarin is also a very good example. Soon you are going to study in hematopoietic plaque. Antacids, you can choose any one of them. एउटा choose गरेर आफूले बनाउन सक्छौ. मैले यहाँ राखिदिएको several अलिकति choice होस् भनेर. With antacids, omeprazole, and S2 blockers, the oral absorption of ketoconazole decreases because these drugs will increase the gastric pH. But this ketoconazole needs acidic pH. Okay, so that's how drug interaction takes place. So we are still in azoles. Next is fluconazole. Okay, let me see the time here. Fluconazole. It has wider range of activity than ketoconazole and achieves fungicidal concentration in nails, vagina, and saliva. Okay, see, fluconazole is better in nails, fungal infection in the nails. Okay, it even can achieve fungicidal concentration in these sites. It has good penetration into brain and cerebrospinal fluid, and oral bioavailability is not affected by food or gastric pH, okay, unlike ketoconazole. Primarily excreted on change in urine and not active against aspergillus and mucormycosis. So it is not used in these infections. So let's see its uses then in cryptococcal meningitis, good penetration so there. Vaginal candidiasis, oropharyngeal candidiasis, candida esophagitis, which is first line drug, tinea infections and cutaneous candidiasis, fungal keratitis. In the form of eye drop it is used, and in adverse effect there is again GI adverse effect, nausea, vomiting, abdominal pain, rashes, headache. What is contraindication? Same, in pregnancy and lactating mother, you can't give fluconazole. And drug interactions like with ketoconazole, the few of the inducers, phenytoin, cyclosporine, rifabutin, warfarin, zidovudin may increase their concentration. Their concentration will be increased by fluconazole. Rifampin decrease fluconazole level to half. Okay, rifampin will induce its metabolism. So those will be reduced to half. So that is fluconazole. Okay, clotrimazole, ketoconazole, fluconazole, very common. Itraconazole. It is broader spectrum drug than ketoconazole and fluconazole. It is fungistatic but effective in immunocompromised patients. Accumulates in vaginal mucosa, skin, nails, but poor penetration is there in the CSF. Extensively metabolized in liver and excreted in bile. Relatively, it has longer half-life, approximately 30 hours is its half-life. Its therapeutic uses in systemic mycosis it is used. It is preferred over ketoconazole. Paracoccidioidomycosis, कति लामो नाम, and chromomycosis, it is considered as drug of choice. These are actually rare fungal infections caused by respective fungus. So itraconazole is considered as drug of choice. Skin ma hune infections harnai ho yo. Histoplasmosis, blastomycosis, sporotrichosis, it is also again preferred over fluconazole. Vaginal candidiasis, dermatophytosis, onychomycosis. Adverse effects, GI disturbances, headache, pruritus, dizziness, drug interaction is similar to that of ketoconazole. So more or less straightforward, self-readable sliders. So I'm just kind of reading it out. So you can choose few of them which you want to know, which you think can be useful. Your rare condition ma drug of choice bhanera सायद सम्झिँदा सजिलो हुन्छ यिनीहरु त सम्झिहाल्छ. So in that way you can please remember them, memorize them. Okay, and others are voriconazole. It's so funny name, isn't it? Voriconazole. Useful in invasive aspergillosis, fluconazole resistant infection. Posaconazole. Recently introduced broad spectrum triazole oil. It is more potent and only azole efficacious in mucormycosis. Mucormycosis ma euta matra azole effective cha tyo ho posaconazole. So few of the things you have to remember, especially यसलाई नै ड्यापर थ्योरीमा नसोध्ला यिनीहरुलाई, हैन कमनहरुलाई सोध्देला. तर like in MCQ it's interesting to go through those kind of characteristic property as I'm repeating that time and again. है त्यसरी त्यही भएर आफैले पिकी थिंग्सहरु चुज गरेर मतलब मेमोराइज गर्ने तरिकाहरु खोजेर You have to memorize. Okay, we will stop here in Alailamin. है नत्र सिदिन्थ्यो म यहाँ एक्लै बोले गरेछु अहिले पनि एक्लै बोले कि क्या हो सुनिरहेछ
Yes, ma'am.
Okay, I'm after it now. So, shall we stop here? कति बज्यो?
Yes, ma'am.
है खुइ खुइ भन्ने भएकोले तिमीलाई एकदम बोरिङ पनि भइसक्यो होला. I myself am feeling bored. Antifungal is so boring in that way. Anyway, pharmacology त्यस्तै छ. 50% is totally dry, 50% is totally you have to memorize हैन. अब यसलाई अलिकति इन्ट्रेस्टिङ वेजहरु खोजेर सम्झिनु पर्ने हुन्छ. 100% कसैले पनि सम्झिदैन. So just have a thorough look, thoroughly एकचोटी रिडिङ चाहिँ गर्नुपर्छ जहिले पनि. Okay, so हामीले आज पढेको कुराहरुमा के कन्फ्युजन छ त? Any confusions?
No, ma'am.